Assalamualaikum. My name is Zehra Vicaruddin and I'm a family doctor in Edmonton with a special interest in the care of the elderly. I wanted to share some resources and information that I find that elderly in our community may not have access to due to some of the challenges that our healthcare system is facing these days. The first most important topic that I wanted to discuss is about goals of care. So what are goals of care? Goals of care are basically a guide that will help your healthcare team know what your wishes would be in case your health goes downhill, or you're not in a position to make that decision for yourself or let your team know what your wishes are at that time. These goals are usually written down on a document made by your family doctor or your healthcare provider when you're admitted to a hospital or a facility, and they're put in a green sleeve, hence also referred to as the green sleeve. Previously, the goals of care was also referred to as the code status, meaning whether you want to be resuscitated or not resuscitated. But truly, goals of care are so much more than just deciding whether you want to be resuscitated or not. They're basically a guide to tell your healthcare team what you want your treatment directed towards. Whether you want it towards intensive medical treatment or non-intensive medical treatment, or comfort measures to improve the quality of your life. The reason why it is so important to get this made by your family doctor before you get admitted to a hospital or facility is because at that time you may not have the chance to let your healthcare team know what your wishes are. And in that case, if you do not have goals of care while you are admitted to an emergency department, the healthcare team will decide for you based on your age and health conditions what your goals of care should be. Broadly, the goals of care are divided into R, M, and C goals of care, and then there are further subdivisions to them, which I will explain in the later videos. It is important that we choose our goals of care in a realistic way, meaning treatment according to what the best clinical practice is given your health condition and expected outcomes and side effects of the treatment that is being offered. Once it is made, it should be put in a green sleeve and then put up on your fridge, as that is the first place EMS looks for when they come to your house. So the two important take-home points for today are: everyone above the age of 60 or diagnosed with a chronic condition impacting the longevity of their life must have goals of care or a green sleeve document made by your family doctor. And secondly, we must make the goals of care as closely aligned as possible with what the healthcare team may choose for you. Thank you.